Okay, so thank you so much. Yes, it's an incredible pleasure to be talking about involvement in rapid evidence synthesis. And so, we will talk about how we've done this during COVID, but just to say that this applies to other areas as well and other health topics as well. And then also to say that through my presentation and for everyone today, when we say patient, we mean the broadest term of patient. So patients, as well as their families and former caregivers, as well as public. So if I say patient, without saying the public, just to confirm that I am meaning that as well. Second here. There we go. So I don't want to read out this land acknowledgement, just to say that the Strategy for Patient-Oriented Research, or SPOR Evidence Alliance, the central office is located in land that is now known as Toronto or Toronto. And so the SPOR Evidence Alliance is actually a pan-Canadian initiative, but our head office is in Toronto. And to make this very personal to me as a settler on this land, I feel it's my life commitment to understand the harms of the past through education. So I take Indigenous cultural safety training courses to educate myself on the harms of the past, and then also thinking towards action and how can I move towards action and how can I make a contribution. So for me personally, my contribution is through participating in the research equity, diversity and inclusion task force with my institute. And so we are always trying to think about our Indigenous patients that come through our hospital, as well as how can we better support Indigenous staff and Indigenous scientists. And so we are from all across Canada, and so we're all settlers on this land. And so I'm not sure if anyone wanted to add to my my land acknowledgement statement. And if so, please feel free, and if not, I will continue on. And I can assure you that we've talked about this in advance and everyone is committed towards reconciliation and moving towards action. So conflicts of interest. So I do receive a small stipend from the Journal of Clinical Epidemiology as an associate editor, and none of the other presenters have anything to declare regarding financial competing interests. For academic competing interests, I think the main one is that I am the nominated principal applicant for the SPOR Evidence Alliance, and also that Maureen, Janet, and Amanda are all patient partners, and I have the great pleasure of working alongside them on many different fun things. Oftentimes they just tell me what to do and I show up. So just so that you're aware of that, aware of who runs the show. So today we're going to talk to you a little bit about the SPOR Alliance, as well as patient and public involvement in rapid reviews and how we co-designed this course, which was led by Janet and Maureen. And then also talk a little bit about the attendee experience. So we'll hand that over to Amanda. Whoops, to help with that. Sorry, everyone. There we go. Okay, so moving on to the SPOR Evidence Alliance. So in terms of our key activities, so we are funded by our national funding agency, so the Canadian Institutes of Health Research. So it's a 5-year grant that actually ends in the summer of 2022. So we've been around since 2017. So our main activity is the research query service. So that's where we have decision makers submit queries or questions that they need research on. And we also help with training, so skill capacity building, skills development, and then we also are highly focused on ideas and innovation. So, excuse me, regarding the query service, this is the thing that we're most, we are very focused on. So we've actually completed or in progress 135 queries since we've been in operation accepting queries, which was April 2018. So we've had a lot of activity with this, with 45 different decision-making organizations across Canada and internationally. So we have an online form that decision makers can quickly submit their questions. We work with the decision maker to refine the scope, and we match them up with an expert team across Canada. So we've actually had 17 research teams across Canada address the various queries that have come in. And we use an integrated knowledge mobilization approach whereby decision makers are integrated throughout, and we want to co-create the evidence with them. So along with the decision makers and the patient partners. So we recommend having 2 patient partners on every query. And we are really trying to work towards co-creation together. And all of our knowledge products, tools, dissemination activities are tailored to decision maker needs. I don't want to spend a lot of time on this, just to say that we did address, or are in the process of addressing, 46 requests related to COVID. So we've had a lot of flurry of activity on COVID research requests, and 10 of these were conducted within 5 to 10 business days. So very, very quick turnaround on these rapid reviews. We also use the principles of open science, and we encourage publication by patient and public partners. So to date, we've had 40 peer-reviewed publications, 85 delivered reports, and 40 other knowledge products. And just to say, please be on the lookout. We have a series of papers coming out in the Faucets Journal, and this will be talking about many different aspects of the SPOR Alliance, including a formal evaluation of patient engagement in all the activities. This is a slide that we're most proud of. So in terms of how have we involved, or how successful have we been in terms of the numbers. So we've had 24 patient and public partners who joined our rapid review course, which is the focus of today. We have an annual seed grant competition for trainees and for new career investigators. We've had 14 patient and public peer reviewers on that who address the impact of the project. We've had 13 patient public committee members on our governance structure, and 4 are our co-chairs. And we've had 224 public patient partner engagements on the various projects. So quite a lot of engagement going on, which is fantastic. So just to say specifically to rapid reviews, Janet and Maureen will be talking, as well as Amanda will be talking about the challenges with this. And from a researcher's perspective, it's hard enough to get the evidence out, let alone, engaging and properly communicating and making sure that, we have the opinions and views of patient partners, which is so relevant, and we want to make sure that we do that properly. So that does make a challenge when you don't have a lot of time. So when we work with our patient partners, we want to use integrated knowledge mobilization. So we want to include them throughout. So at the very beginning, as we're working on the report and writing it, and then we also highly encourage them to be a co-author. And we have many resources on this, not only for patient partners, but mostly for researchers, because this is a different way of doing things. So definitely check out our website where we provide more information. So we had received feedback that the patient partners wanted additional training, especially related to COVID and all these rapid requests. So before COVID, we were doing things within 3 months. That was considered a rapid review. And then within COVID, we were asked to do rapid reviews within days. So we tried to come up with a product where we could complete this within 5 to 10 days to address urgent decision-making needs. And it was a real challenge. Because we are very passionate and believe that we want to bring the patient's voice closer and closer to policy decision-making as much as possible. So how can we do this well? So there was this need for this course. So we developed a course, and the course was co-led by Maureen Smith and Janet Gunderson, who I will pass to right after this slide. And so at the conclusion, we had developed a panel of 24 patient and public partner members who were ready to join the rapid review team. So this was our little flyer that a little advertising that we did on social media, trying to attract patient partners to come join us on this course. And with that, I will pass this to Janet and Maureen next.
Okay, thank you so much, Andrea. So this is the part where Janet and I are going to talk about how we co-designed the course. So next slide, please. So I'm going to start with the evolution of our partnership, because Janet and I really feel that it was an essential element in co-designing and co-delivering this 10-hour course. So I'm going to use a cake just because it's the pandemic and cake seems appropriate. So here are the ingredients for the rapid review cake. So we're going to start with lived experience as the base ingredient. So Janet and I are both SPOR Evidence Alliance patient partners, and we're both experienced Cochrane consumers. Therefore, we have experience in systematic reviews and evidence synthesis. We both have experience with taking evidence synthesis courses and other methodological courses and workshops that were geared to researchers. I'm the co-lead of the COVID and citizen partnerships. And so I was already collaborating with Andrea, and we were thinking about training because we had this pool of citizens who were ready and willing. So I really did the happy dance when Andrea opened up 10 spots for our public members. Janet and I had never worked together, but we quickly developed a wonderful working relationship. And I'm proud to say that I call her my friend now. So it was a perfect storm. We jumped in, we jumped at the occasion to collaborate with Andrea and her team. Next ingredient is about half a cup of flexibility. So the SPOR Evidence Alliance team found out very quickly that Janet and I were both teachers and that we had lots of ideas about what the content of the course should be. I'm not sure if it was what the team expected when they engaged with us, but they welcomed our ideas and they gave us a great deal of leeway. You know, this often happens when you engage patient partners, and you're wise if you're open to embracing their abilities and skills beyond their lived experience in the healthcare system. So I'd say that the team adapted what they probably had in mind with what Janet and I were willing to do. And I think it was a brave move. So I'm going to throw in a good cup of mutual respect. So just as Janet and I were respected for our skills and knowledge, it was the same for the SPOR Evidence Alliance team, who had much experience in delivering courses and those logistics. So Janet and I did ask at the beginning if they could avoid putting the finishing touches of the course together at the last minute, as we would both find that stressful, and they were very respectful of that. So finally, last two ingredients. So co-learning was gently mixed in throughout the rapid review course cake. It happened every step of the way in designing the course, and then carried out in those 3 weeks where we interacted with a great group of patient and public partners. And finally, the icing on the cake was that it was indeed a model of co-production from the very first ideas to the final stages. And it continues, because at this point, Janet and I are first authors on an article that we're working on. Next slide. So it all sounds great, doesn't it? Woohoo! But of course, there were challenges. So I'm gonna go into the challenges and what we offered as solutions to those challenges. So firstly, as you're all aware, the impact of that first wave of the COVID-19 pandemic was incredible and unbelievable. So everyone's lives were topsy-turvy. So we had to find a way to work around that. So many patient and public partners were working from home. They had health issues, that they were worried about what the impact if they got COVID. There were childcare and elder care were big issues. So we also needed support from the SPOR EA team, and who were redeployed and struggling with the pandemic themselves. So our solution was to offer a course that was spread over 3 weeks with only 3 of those hours at a set time. So we thought that the self-paced learning would be beneficial, but we certainly wanted to have that virtual live learning too. So that was the solution. The quick turnaround time was really the second challenge. So research teams were producing many rapid reviews without the benefit of patient and public perspectives, and the clock was ticking. So Janet and I were willing to spend a considerable amount of time to move things quickly, and Andrea made sure that the course was a priority for her team too. So that did mean that course development decisions were made quickly, and basically Janet and I, in collaboration with the Evidence Alliance, relied on our previous experience and just hoped for the best. So had we had the luxury of time, we would have been able to consult more broadly. So it was one of those fingers crossed that we got this right situation. Thirdly, I think that Janet and I had the most, where we had the most impact was really in selecting the content that was geared to our audience. We had been those people attending courses on methodological topics. We tried to get that balance between theory and practice. So what did our attendees need to know to be prepared to meaningfully engage in evidence synthesis reviews? Janet and I had many conversations about that, all the way through. So our overarching theme was keep it real. So we collected all the resources that we could find that had been produced for patient and public involvement by organizations such as Cochrane with their consumer rapid response team, and Evidence Synthesis Ireland. We used one of your great videos, and then we added that pragmatic component so that the course would present a realistic picture of what it could be like to partner with a rapid review team, especially with the quick pandemic turnaround. So Janet will be delving into that, what we did next. Finally, our last challenge was recruitment. So there was this unprecedented need now for public partners, as COVID-19 is a public health issue with broad consequences. So we couldn't just rely on those great people who engage for disease-specific reasons. So that the public partners that we brought in may have been entering this world for the first time, as you're going to hear from our last presenter, Amanda. So they had no training in what we in Canada call patient engagement. So we recruited 24 participants from that SPOR Evidence Alliance partners and the COVID-19 citizen pool. And we achieved, geographic and age diversity with 9 provinces out of 10 in Canada, no one from the territories, and participants from all age groups fairly well distributed. So gender diversity reflected that strong female patient partner population. So we couldn't really flip that over. So we had more females, and we had a variety of perspectives. So we had patients, family members, caregivers, members of the public were all represented. So it was challenging to deal with the varying levels of experience. So in hindsight, we could have provided more information for the people who were just beginning their patient or public involvement journey. We recognize that now, but fortunately, there was much generosity in the discussion boards with the more experienced people sharing their insights and helping everyone out. And the next slide, I'm going to turn it over to Janet, because I'm sure you're, okay, enough of this. What did you do? So Janet's going to present that.
We started, each week was the same sort of setup, but before I get into the actual course content for week 1, as Maureen said, we were aware that people, their lives had kind of been turned upside down and they were working from home, and their schedules were topsy-turvy. So there was a self-paced pre-recorded webinar for each week. And then there was a reflection journal, and we asked them to have a conversation with 3 other people from the class on Canvas, and we could watch that, and Maureen and I would sometimes comment on that. And there was also a live session each week with a guest speaker. I think one of the keys that helped before we even started week 1, we had a meeting with the participants where they could learn how to use Canvas. There was a module to learn about patient-oriented research that was optional for those who didn't know about patient-oriented research, and we did have a couple of them. And also the Evidence Alliance, they had a contact there where they could get help if they were having trouble accessing Canvas or whatever. So Maureen and I, being teachers, had to have learning objectives, is the way we tend to set things up. So the first week's topic was what was knowledge synthesis. The objectives were to recognize terminology and use in knowledge synthesis and patient and public engagement, to understand the role of knowledge synthesis in healthcare knowledge and synthesis products, and to understand the basic components of a systematic review. It was a rapid review course, but if you don't understand a systematic review, you're probably not going to understand a rapid review. And we were to describe the range and level of patient engagement in knowledge synthesis and key considerations. So the self-paced part of the course was the pre-recorded webinar. Each webinar ended with a quiz and questions for the reflection journal. The quiz was based on a Likert scale. It was very short, but I think it was very useful because we could tell whether they grasped the topics or not. It was also useful later on in the evaluation. The questions for the reflection journal were discussed in Canvas, and they interacted with 3 or 4 other people. So that was always interesting to watch those conversations and see how ideas sort of form and develop. And sometimes Maureen and I would comment. Next slide. The learning objectives for week 2 were to demonstrate a basic understanding of rapid review steps and why they are useful, to understand the reasons for doing systematic reviews and rapid reviews, and when you would choose a systematic review over a rapid review or a rapid review over a systematic review. Understand rapid reviews and patient engagement in the context of COVID-19, and to learn from a rapid review conducted by a researcher patient team and how it led to COVID-19 guideline developments. So here in Canada, the National Advisory Committee on Immunization, known as NACI, did not give approval for the COVID vaccine for people who were immune suppressed. This is because they were not included in the clinical trials. A small group of patients that I belong to, called the Canadian Arthritis Patient Alliance, approached the Canadian Rheumatology Association, which is the professional organization of rheumatologists here in Canada, with this concern, and of course they shared the concern. So this group decided to do a rapid review to see if it was safe for people that are immune suppressed to take the COVID vaccine. The problem was there was no data on the COVID vaccine because we hadn't been included in trials. So what they did is they used data from all the other vaccines that are out there that we take, and it was showing that it would be safe for us to take the COVID vaccine. This was done in a 4-week period. So this was 2 patient partners with a group of rheumatologists and statisticians and you know, those sorts of folks that all belong on a team. So they went back with this data to NACI and presented it, and it led to a new set of guidelines in Canada, where NACI did say that people who are immunocompromised or immune suppressed were safe taking the COVID vaccine. The 2 patient partners from that group that were our guests on this week 2, their names were Dawn and Lori, and they were very honest about how their experience was and why and how it was done so quickly. It was very intense, the number of hours they put in. This was an excellent example to show why a rapid review is so important, especially in the context of COVID. It also showed the impact that it had, because it literally did lead to a change in the guidelines, the national guidelines. So it was very interesting to hear that story of their experience. And it was their first rapid review for both of those as well. Next slide. Week 3, our learning objectives you see there was to analyze the list of rapid reviews conducted by the SPOR Evidence Alliance. They are on the Evidence Alliance's website, along with their other knowledge synthesis products. I invite you to go look at it. There's quite a list, and it's interesting to look at who did them and so on, and the topics, quite the variety of topics. One of our objectives to understand the challenges of conducting rapid reviews during COVID-19. We've discussed a few of those. And to use a case study and learn practical skills for patient engagement during a rapid review. So the case study is the part that Andrea was our guest speaker on the last session. She walked them through a rapid review and where patient partners could or should have been added in for previous rapid reviews. Talked about that. And then our 2 guest speakers were Donna and Carrie, and they were from another SPOR evidence group called Child Bright, And their topic was children with brain-based developmental disabilities, and their rapid review was done in 2 weeks. So that was very intense for them. And I remember one of them were asked a question of how many accommodations were you given, and she held up her fingers and said with a big fat 0. So they were kind of put in over the deep end because this was before the course, and I'm sure they were helped some, but you know, they definitely found it very intense. They did enjoy it as well. So we heard their descriptions of a 2-week rapid review, which was interesting. And of course, each one of them had an experience in that as a parent in that area. So Andrea walked us through the class with a case study, which was also interesting. We found the feedback from the Likert scale and the survey of each class very interesting. I think it helped us. It also helped us know if there was something we needed that we hadn't quite covered well enough the week before. So I think that was one of the things that was important to note. Next slide, please. These are slides from our evaluation, so I'm going to go through them very quickly. Pre and post knowledge of evidence synthesis. You'll see that we had very little or no knowledge of evidence synthesis, and the 2 at the bottom where it changes to the red color, their knowledge, they feel very knowledgeable or knowledgeable about knowledge synthesis. Next slide. Pre and post knowledge of public and patient and public involvement in evidence synthesis. We had some people who were not knowledgeable at all, the top bar. We had quite a few who had a little bit of knowledge. By the bottom 2, we had most of the class felt knowledgeable or very knowledgeable about public and patient involvement in evidence synthesis. Next slide. Pre and post knowledge of rapid reviews. Most people were not knowledgeable at all. Some had a little bit of knowledge. By the end, most felt knowledgeable or very knowledgeable. And that felt good to us because it did show that they really did start to get where they could be involved in a rapid review effectively. Next slide. Pre and post knowledge of public and patient and public involvement in rapid reviews. Again, some were not knowledgeable at all. Some had a little bit of knowledge. And by the end, most felt knowledgeable or very knowledgeable. Next slide.
Okay. That's me. Thanks, Janet. I'm going to talk a little bit about the evaluation before we wrap up this section of the presentation. So our course evaluation had 2 components. So this weekly survey that Janet talked about that focused on the learning objectives and a comprehensive evaluation at the end of the course. So for the weekly survey, we asked the attendees to fill it out at the end of the live session. So using our teacher voices, Janet and I would say, we're going to end this session 2 minutes early so that now you can press the link and fill out the survey. Well, our response rate was 100%. So even though we're both retired from teaching, obviously the voice still works. So we were able at that point, then we would wait anxiously to see, you know, had the people felt that we had met the objectives that we set. So it basically was for each learning objective, we asked them to state their level of mastery of the objective. So there were between 3 and 5 questions because there were between 3 and 5 objectives every week. And then we included that free text box, and some of the responses you see here are from that free text box. So for example, for week 1, we would write, I understand the role of evidence synthesis in healthcare. Or for week 3, I understand the challenges of conducting rapid reviews in the COVID-19 context. And then using the scale of strongly disagree to strongly agree, we would ask people to do that. So that gave Janet and I an opportunity to return to concepts if necessary. And so, you know, like I said, we put this together very quickly and we kind of had fingers crossed that we were getting it right. So it was really important to us to put that element in. So fortunately, the course participants reported that they had a good understanding of the course material and they were consistently increasing their knowledge. So that was really encouraging. And here's a sample of what we heard. So Someone reported, I'm learning a lot in this course. It's helping build my confidence. I participated in one rapid review before the course and tended to downplay my contributions. This course is helping me understand my role as a patient partner and to see the value of my contributions. Music to our ears. Someone else talked about the format. I find the whole format of the course conducive to learning. I take time to assimilate what I learned through reading, watching videos, etc., before making an entry into the journal, which then opens the door to further learning, as does the interactive session at the end of the week. Next slide, please. So at the end of the course, we conducted a comprehensive evaluation with a 96% response rate. This included all of the components of the course. So the pre and post learning, the self-paced learning experience, the discussion board, the live discussion, and the overall experience. So on average, the course was scored very highly, with 96% of the respondents agreeing somewhat or completely that their learning experience in the training program was valuable. And I put a few examples of what we heard about the different parts of the course. So someone said the course was pretty comprehensive. It covered most of the information that as a patient public with lived experience, I need going forward. Another person said, overall, I still found a lot of value in the course. It's very difficult to do online learning with very structured boundaries, and a lot was expected of the participants. True. In a short time frame, I thought, so very ambitious. Someone commented on the dialogue with the other participants to be of great interest and benefit. Again, on that interaction, it was very helpful to hear others' experiences, their fears and uncertainties about how these were resolved. And finally, it was so informative to hear from people who had been there, done that. And I'm handing it back over to Janet to wrap up our portion.
Okay. This is a screenshot of some, not all, some of the examples of rapid reviews that involved patient and public partners. I invite you to go to the Evidence Alliance to look at them. Obviously, they're too small to read here. You'll see the list of topics is quite variable, you know, from health implications to what happens in schools. There's all kinds. Obviously, vaccination was a big one. The one in blue, I'm sure, is a COVID-19 one, and they would have a website with some of theirs as well. So there was lots of different ways of creating and integrating patient and public perspectives into the reports. For example, even just adding a box to the report that focuses on the patient and public perspectives. So we're hearing lots of positive feedback, but not all experiences were positive. I think that sometimes researchers would like to include us and don't honestly know how, because it's new to them as well. Our course participants have all become members of a rapid review panel and have been involved in 6 reviews for COVID-19, 4 different external reviews. 23 public and patient partners have been matched to 15 SPOR Evidence Alliance rapid reviews. And I know it's still happening. I got a request myself yesterday that I actually had to turn down because of other commitments. So, you know, this is not ended. This is an ongoing project. Next slide, please. The impact of the training. The rapid review course was designed to respond to the important needs for patients and members of the public to contribute to rapid reviews, and it has met its goal. Doesn't mean our job is done, though. All of the rapid review panel members have contributed to rapid review evidence synthesis products in Canada and internationally. We do have plans to offer some kind of trained focused course, force researchers on how to involve patient partners in rapid reviews. We know there's a need for that. We've heard that. And I think because it's new to them, it's just like when patient-oriented research came out, that was new to researchers. They had to, you know, learn how and where and how capable patient partners can be. So we are going to, that's one of our goals, is to work on that. As Maureen said, we are collaborating on a publication about this class, about how it came about, you know, the honest ways it worked and, you know, where it could have been better, those sorts of things. And I'm not sure when that publication will come out. It's fairly near to being done. So I think we're off to Amanda now. And Amanda was a class participant.
Hello,
Go ahead,
everyone.
Amanda.
Hello, everyone. Thank you for allowing me to speak today. I really appreciate the experience. I should tell you a little bit about myself. Tom actually gave a great description, but my children range in age from 8 to 21. They're all still at home, school aged, and one university aged child. We've navigated the medical system and the educational system for various reasons, but my lived experience was part of my motivation, but the reality is I was seeing all kinds of information about COVID being shared online that was inaccurate, or there would be things that would say something like masks don't work, and I would gently say there is no evidence for things at that time. This is very early in COVID and stuff, but people didn't quite understand the difference between something not working and there not being evidence for it. So I was really intrigued by being able to join COVID End initially, and then being invited to join the SPOR EA. Next slide, please. So what I'm showing here actually is a bit of a timeline, and I will tell you between the invitation and between me meeting the lead researcher on the first rapid review I was on was 32 days. So to me, trying to navigate all of the responsibilities of being a parent in a big family, it was quite quick. We had the invitation, the acceptance the next day, a welcome 2 days later, an onboarding package, the orientation session, and then our 3 weeks of learning. And then it was like, yes, I'm ready to go. So next slide, please. I want to say that this course was really setting us up for success. So there was a lot of us there that didn't really hadn't had experience in evidence synthesis before, and there were some that had some experience, but a lot of us did not. I really appreciated the super clear communication. So you heard Janet talk about what was taught in the course, but to me, the setting up for success came even before we were in the course, and that was the onboarding package that was sent to us, where we could see pictures of who developed. And you might think that's a small thing, but it gave us a context for the people that were going to teach the course. So to me, it's like getting to know you before we get to know you, because there's no time, not really much time to build relationships too, when everything is done so rapidly. We were shared the expectations for the course and for being a patient partner with the SPOR Evidence Alliance, how to access the course, which can be very important if you're not familiar with a lot of online learning systems. Contact information. So we already had support in place if there were any questions or technical difficulties, and our terms of reference. We were given, and we were, shared already the vision that it's to facilitate meaningful and valuable patient researcher collaboration in the rapid review projects. So we already knew that ahead of time. So already they're sharing with us what's expected, where we're going, and how it's going to be done. The orientation session was a very warm welcome. There were introductions. All of us got to introduce one another, ourselves, as we were comfortable. And that also set us up for being able to interact with one another on those boards and stuff that were talked about earlier. Again, the overview of the course, the expectations, and how to navigate the course, the Canvas learning system, but also how to navigate Zoom. Some of us know how to get on Zoom. Some of us have difficulty at some times, but also just all those little details that, if you recall back at the beginning of COVID, when everyone was thrown into Zoom, you might have had difficulty with yourself. And also about the compensation policy, which also sent the message that this is important and such, and you're getting paid for your time. It's one of those little pieces that does add to things. Every week we had the overview and the agenda of the learning objectives that Janet showed you. We also given access to resources such as glossaries. I say jargon busters here because one of the very first things that was done is all of these terms are used for evidence synthesis and things related to evidence synthesis. And if you look at that, it could be overwhelming if you're not familiar with the area, but this was a great introduction to some of the things that we would learn. And what I said, and Maureen commented on when we were practicing with the session or sharing what we were planning to talk about, was that speakers were excited about the work. Now, my oldest is in second year of university, and I know they have trouble, and I know I had trouble when you have a teacher or a professor that isn't excited about what they're teaching. It's harder to pay attention, it's harder to learn, it's harder to be excited yourself about the material. So this was really important to me. And next slide, please. What I appreciated about the course was the flexibility. Yes, it was self-paced within a time frame. And it was a short time frame. Now, one of the comments from earlier was it was a lot in a short period of time. And one of the things that I would have to say about that is rapid reviews are done in short periods of time. So it's nice to kind of get that thrown in experience for this training course, because you can apply the skills and things you learn there to a rapid review. The different methods for learning, such as the reading material, the videos beforehand, the discussion prompts, and the expectations that we would respond to other people's answers. So it wasn't just a matter of going in and writing what we thought. We actually had to read and digest what others thought and think about our responses to them and actually respond. So that allowed for lots of learning from other people more experienced than us, and also allowed us to question things if we were less experienced. And we were encouraged to think about questions to ask those people that were coming in live in the interactive live sessions. So we had Andrea in the first week, as said, but we had 4 experienced patient partners. And I say experienced patient partners because they are experienced in research, engagement research or involvement research. Their experience with rapid reviews was much less. So, but they shared their experiences. They kept it real. It wasn't all, this is going to be fantastic, everything is going to work really, really well and such. There was real experiences, and there's lots of answered questions. So things that we weren't clear about and really we're still curious about were answered. And there were also optional resources for those of us that wanted to dig a bit deeper. I have to be honest, I have a whole list of resources like that when I get a little bit of time, I'm hoping to delve into, but I'm not quite there yet. So the messaging, Andrea, next slide, please, that we received based on the content and how the course was done was, we want you to succeed. You have support. Your experience is valued. This is important work. We are in this together. And I should say, I do believe that the course had a lot of what we needed to do to feel confident and competent to participate or to partner in rapid evidence synthesis. Even the last week where we did case studies and we looked at case studies and said, okay, this is where patient partners were incorporated into this work, or this is where they could have been, helped us to think logistically about how we could be partner in rapid reviews. Next slide, please. So here I'm at this point, I say at the end of that 32 days before that I felt ready. Well, at least a lot more confident and competent, as I said, than before the course. Our introduction in COVID-19 was very short with no training, and I was like, but with this course, I felt like I could have a voice and I could contribute. And so this was my first rapid review experience, and we're pools in the SPOR EA as well as in COVID-19. So there's a matching process that happens. And I was matched to a review about what is known about reasons for parental vaccine confidence and uptake for children and adolescents. Again, 6 children, my youngest is 8, so we're not really too far out of those preschool vaccination years, and my oldest is 21, and I have a slew of teens and preteens, vaccination is a very common topic in our house. And this is just the timeline of what we went through, meeting with the lead researcher so we could establish a little bit of a relationship early in the expectations, me questioning what's happening because the timeline was actually extended more than they thought. And then there being a new plan because we had to swap lead researchers because of the time it took, which was not expected. The course did not prepare me for that. I had no idea. And getting a partial review so I could look at themes and gaps and be able to comment on it. Getting a draft review, having a Zoom meeting with the new lead researcher, and thankfully both the lead researchers on this were lovely and we got along quite well. The review was posted, and this little reaching out was because there was just one sentence or part of one sentence that I didn't necessarily agree with. And here goes back to the support, both from having had the course, but also like I reached out to Maureen and said, I have a little bit of an issue with this. And she said that they could contact the lead researcher or I could do it. I'm not sure if I had not had the course and understood that things aren't always positive and that there's, you know, we're all learning, researchers are learning, patient partners are learning, that I would have necessarily reached out, but I was able to reach out and say, you know, I don't totally agree with this. This is what I was trying to get at. That edit was made and the final review was posted. And then the particular organization I was doing this review with made a point that from there on out that the patient partner would read the review before it was posted. So it was actually a good experience. Next slide, please. Where am I now? I'm part of an advisory panel for the Determinants of COVID-19 Health-Related Behaviors project, or the COHER project, where we're looking at the determinants of behaviors, or what kind of things affect our uptake of the behaviors that are recommended to reduce COVID-19 spread. And this is just showing the evidence of gap maps, some early evidence for COVID and non-COVID related respiratory illnesses like SARS and H1N1. And this is the evidence and gap map that we didn't learn about in the course, but we were introduced to. And the first meeting we had was actually filling in some of the things that weren't thought about by researchers. So we've already had an impact on this project. Looking forward to the systematic reviews that are going to come out of this project. Along with this evidence and gap map, there's a systematic reviews plan for each of these practices and what affects them. And we're going to have an opportunity to prioritize what's important to us for those reviews. So what comes first and such. And this is very, very exciting for me. And I'm working with other patient partners and a team from across the world. So if you would have asked me last year before the course, if this was something I would be undertaking this year, I would have absolutely thought, no way. But now I have an opportunity in the context of COVID-19 to be part of this work, and I'm really privileged to do so. And again, thank you. The course to me was very important for me developing the confidence I needed to do this type of work as a patient partner. Next slide, please. We want to thank you today from all of us for allowing us to share this experience. And if you have any questions, please put them in the box.